His life was very
complicated. He was so the naive part of it. That's what's fascinating me. He didn't know what ice was. He didn't know what it was for, and some questions and things like the cars that would go down Fannin Street and go under that underpass. They never came out because he couldn't see the other side of it.
That was a big part in the book, how he did not get three-dimensionality.
Right.
Of things. Did you ever talk to him about that kind of thing?
Yeah. I drew him a little sketch. I said, okay, that's an underpass. Cars go down there, but here's a road that continues on, and they come out and continue on.
That's a complicated stretch of highway for anyone, really.
Yeah.
But,
yeah.
But yeah, I thought that was very interesting. What was your first interactions with David like?
The first one, he was very small and not much at all, because we were testing the unit. Are we filming? Okay. We were testing the unit to see that it was electrically safe. There was no leakage of current, anything. And he was kind of a small infant, and it was a small bubble then, about the size of a car, of an automobile, and it was much smaller. So not much interaction there. But as I went back and we tried to enhance his life, make things better for him, you got to know him, and then he got to know me and would talk to me, and I would tell him the truth because there was nothing else to do, no reason to not. And he just kind of trusted me. And so anytime anyone had any questions about anything, he wanted, no matter how much engineering they had, he wanted to run it by me. He trusted me, so yeah.
What do you think made you trustworthy?
I guess because I was not there with a white coat. It's going to take blood, do tests, all the stuff that would hurt him or pain or checking, because I was harmless, and I would joke with him and talk with him and back and forth, and he would ask me questions like my beeper that had a 9-volt battery in it, and he wanted to know how far it would go. And I told him 40 to 50 miles, and he wanted to know how many of those batteries would we have to go to the North Pole to Santa Claus.
Love it.
Yeah.
Love it.
He was very intelligent. He was naive because he hasn't been around the things that we all grew up with and was taught from day one. There was no one there to teach him about hot and cold, ice, and all the things that we take for granted. But he was very intelligent, and he would ask you a lot of deep questions. But he was a little mischievous too, because he would pull some pranks on you, or he'd get after you a little bit if you.
Can you remember a time when he did that to you?
Well, the one time I went up, I was seeing him in the afternoon, and he had a small black and white TV in the room, and somebody donated then what was outstanding, a 19-inch color TV. You remember how great those were. So I told him, I said, tomorrow you're going to get a new TV, color TV. He said, great, I want a red one. And I thought he was joking with me again, so I didn't reply to that. The next day when we were putting it up, he is pouting and he's not very happy. And I asked him what was going on. He said, you promised me a red one. And I said, just wait a minute. We turned it on. He said, oh, I understand now. The colors are inside. Oh, okay. Then I was looking for a letter that he dictated to the nurses. They wrote to me, thanking me for installing his new color TV, although it's not red, and inviting me to come up and watch Sesame Street with him. He didn't realize at first I had other duties, that I couldn't be there visiting with him all the time, which he would like. But I had, St. Luke's and Texas Children's, the whole electrical system. So this was a small part of it. But I visited with him a lot. But a lot of times I said, David, I got other stuff I got to do,
Exactly. Can you tell me what this is?
This is a painting, the only painting that he ever drew for anyone. And the nurses sent it down to me, and the carpenter shop made this little frame for me. And it's a rainbow, and it's very dim, but it says, "To Tom, F-R-U-M, David." And it's one of my prized possessions.
Can you tell me about whenever he talked to you, what it was like to converse with someone who was inside that enclosure?
It was difficult. You had to speak louder because of the thick wall of that stuff. There was gloves that you could reach in and do stuff, but you had to speak very precise and loud, and he knew that too, and he would speak back. There was no electronics, there was no microphone or anything, no intercom system there. It was just the voice.
Yeah. Was he, in the book they talked a lot about the emotional toll on him. Could you see that as the years went on, that it was starting to affect him in that way?
Yes, there was days he would be upset, and you never knew what it was. And he was bothering, he was pouting, and he didn't want to talk. And then after a while, he'd get over it. Something, or we'd say something, or something else would go on, or some thing. But yeah, there was times when he went into some moody times, right?
Yeah. What was it like whenever you heard that David's health was taking a turn, and those final days of his life?
Unfortunately, we were on vacation, and we was out of the state. I don't know if we'd been on a cruise or what, but I missed that part. I was not here when he. I knew that they were going to go and get the bone marrow from his sister and do the bone marrow transplant. And a friend of mine was one of the Houston policemen that escorted the family and brought the bone marrow in and did all that stuff. But the actual procedure, then his downturn and eventually death, I was not here. So I kind of missed that.
When did you hear?
Well, I kind of knew about it as soon as I got back in town. They let me know, because I went to, you go back to work. And, that's the big thing. You know it there.
Can you tell me what it was like going into work that day?
I don't remember a lot about it, but it was difficult because I knew that area would be shut down, that room, the bubble would be torn apart, it would never be used again. And I really don't even know what happened to that bubble. I don't. I knew it was in working in a hospital, and then I worked for hospice for a while, you get used to a lot of people passing on and moving on and stuff. But this was especially tough. It was because he was my buddy. He would sometimes when he talked to me, he called me by my name, Tom, back and forth. But when he talked to the doctors and nurses, he said, "You need to talk to Mr. Langford." He changed it to Mr. Langford then. In his early days, it was Wangford. But he finally got to Langford. Yeah.
That's great. It sounds like from what I gathered from the book, that he had this whole universe around him in that hospital that was, that he, like you said, he had a playful side, also a cranky side, that he, just like any human being, of course, but he was very special in some ways.
Right.
Could you talk about ways that you saw him as special?
Yes. One particular thing was some of the nurses and doctors too probably talked down to him as a kid. Well, we had two blowers that blow the air, circulate the air through the big bubble. And this was a big bubble, probably as big as this room almost, maybe the size of this rug. And two blowers that constantly blowing. And David started complaining to the nurses and doctors that one blower is not not working as good as the other one. And they said, "Oh, David, you don't know what you're talking about. You don't know what to." So David was a little chair there, and there was some crepe paper stringers, and he put the chairs in front of each blower and put that crepe paper, and it would blow one straight out, and the other one was down. It wasn't blowing as much, and he proved it with his chair and the little ribbon, and so they got us to come up and check it, and sure enough, it was slipping on the fan, on the shaft of the motor was not tight, and it was slipping, and it was not producing as much air. And he solved that because they was not going to listen to him. "Oh, Dave, you don't know what you're talking about," So.
Were you in charge of any of the stuff whenever he went home?
Yes and no. I went with them to their house one time, and early on it was really bad because his family had a big SUV, and they put that smaller carry bubble, which was small, in the back of that SUV, and with no airflow. And to get him to up near Spring, he lived in just north of Spring, in that area there, and he would just be sopping wet with sweat the time they got him there. So we used an inverter that would invert DC to AC, and we plugged this into the cigarette lighter, which is DC, and that converted it to AC, and we could plug in a fan, and we recycled air through there for him on the travels back and forth. And then they set the bubble, they had a home bubble that was bigger, like a whole big, and there was some organization or some lab or something that built that and tested it, and it was okay, so I didn't do anything with that. The only other thing I remember, though, on one occasion, we went there and NASA had built his spacesuit. So when he got there, he got out in the yard and places he'd never been, and his greatest delight was to get the water hose and squirt all the reporters. Yeah, he tried to soak them. He thought that was great. He thought that was great fun. But he would open drawers, turn doorknobs, flush toilets, faucets, turn on water, things that he had never done. Hadn't been around, hadn't even seen.
Do you think of him as a little boy? Do you think of the man he could have been?
I think of him as a little boy, but I see it both ways. His early life, it was tragedy that he had to live in that kind of condition. But Dr. Shearer, it was mentioned in the book, he and I was having breakfast one day, and he told me the number, and it's in the thousands, of kids that life were saved because of the research that they got from David, from David's life, and he saved thousands of kids' lives from. So it's both. It's tragic that he had to live that way and die that way and go through that, but there was some meaning to his life. He contributed.
Yeah. How did he contribute to you?
Well, I never had kids, and so he was not like my child, but he was close. He was just I really liked him. I enjoyed being around him, and he kind of lit up when I was there, and he trusted. If I didn't have a white coat on, so he trusted me more than those guys and stuff. So he would tell me things that, I don't know what all he would say, but just he would open up more to me. He was real friendly and open to me.
Did he ever tell you something that you could share with us?
Oh, I can't think of anything right now but I know in the book it tells you about the hearing test, that he was pouting because they were going to give him a hearing test, and they tried to convince him that there was no pain, nothing could hurt you or anything like that. And then they didn't tell me, but they got together and said, what if Mr. Langford put a special wire in there that had no germs on it? And he said, yeah, that's good. And later, when I was up there, he told him Mr. Langford's wire worked because no germs came in. He was good. But he was aware, as a little kid, he was aware that if germs came in, he could be killed. You know, he knew that, and he was cautioned about that.
Did you have pity for him as he was like in this small space, like the?
If I did, I didn't show it because I didn't want to bring him down. I wanted him to stay upbeat and stuff. And Mary was too, you know, she all that stuff. So no, I didn't. If I might have thought it, but I didn't say it.
Anything that I didn't ask that you wanted to add?
Well, there was some interesting things that happened with his life. I thought one of the interesting things was, really, David didn't have anything to do with it, but when NASA built the space suit, we had a press conference, and in those days we had the press conference in the auditorium, and all the networks would come in, set up the tripods, and film this thing, you know, and stuff. And so they filmed him getting fitted for the suit and all that stuff. And back in the day, they just had reels of film. And so we got the reels of film, and the next day at the press conference, each network was going to get a copy or thing like that. But networks want theirs early and up front. So we knew that public relations would probably be broken into that night looking for the film, and it was. They broke in, but the film was in my desk drawer in the basement.
One of the things that's fascinating about the end of the book is, and I got that feeling through the whole thing, is that David presented himself differently to different people.
Yes, absolutely.
It seems like he was holding court around his whole, it was his world.
That's right.
You know, and
if you weren't in it, he wouldn't give you the time of day. But I don't know why he liked me. I could walk in and have a conversation and chat with him and whatever. He went to school, you know, he did have a tutor, and he went to school in the bubble. And he had some place, so yeah, he got some education.
Did he ever say anything about the term bubble boy?
No, he didn't. He never referred to that at all. And do you know also they had way back, many years back, a film about the bubble boy, a baby, the bubble. John Travolta. It was the biggest farce. It was just ridiculous. It's an embarrassment. If you ever saw it, you would just say it's not even close. He escapes out of the bubble and goes and runs with his girlfriend in the woods. Oh, it's just a joke. Now,
would you support other people having or doing films or any kind of documentary about David's life?
I wouldn't have any problem with it if they kept it factual and wouldn't go in for the slander or you know, and just kept it upbeat and just told his true life. TBS did a story. We went down to the Heights and he had rented a house, and we filmed all day. And they cut everything out I said out.
How is David's story a Houston story?
Well, it happened here in Houston, and it happened at Texas Children's, and I think it was put Texas Children's kind of gave them a little notoriety of fame for being there. And it's a Houston story also because after the book came out, I have some inside information that there was a unnamed Houston oil man that picked up a tab for all this. And his employees that knew about this were sworn to secrecy or they'd be fired. And so that's quite interesting. That's a Houston story, the Houston oil, the oil man, and picking up the tab for 12 years of medical care. That's quite a package if that happened.
It's fascinating. If you ever want to drop that name, you just let me know.
Maybe I'll drop it to you off camera. How's
Okay.
that? All right.
Sounds good. That sounds good. I think I'm good.
We've been asking this whole time about, his impact on your life. Do you stop to think about what you were able to provide for him? Because he called you Tom, but if anybody else was in, he made them call you Mr. Langford.
Yeah.
It seems like he had a reverence and a lot of respect for you.
I think so. I think he did. Yeah, but I really don't know why. I guess because he trusted me. Because I told him the truth. There was no need for me to tell him, you're going to be better, you're going to get well, you're going to do this or all that stuff. And, his medical care was somebody else's. They took care of the medical stuff. But I just made sure he had a safe environment, that it worked properly, and he had a TV, and we had a way to transport him and to give him the best that I could to do, and just share a little bit of my time with him, because I had 2 hospitals to take care of, and I couldn't be there day and night. So, but 2 or 3 times a week. And there was, like the book said, there was a couple of times that I took my sack lunch and went up, and I sat outside his bubble, eat my lunch, and he'd ask me all kind of questions about rain, the weather, what's out there in the cars, and just stuff that we all knew from childhood. We grew up knowing, but he didn't. He didn't know that ice was cold, and what do you do with it, and a lot of stuff. And the one thing I thought was fascinating was, and I think I even agree with him. There was a lot of people, news people, interviewing doctors, nurses, all kind of people always around him. Seemed like there was no privacy there. And he had food in there, and he had his water and stuff, and he would drink water. But when he would urinate, he just would do it. And they said, no, David, you have to go behind the curtain. And he asked me, he said, why can I take in the water in public? But to get rid of it, I got to go behind the curtain. I said, well, you got a really good point, David. You really do. But I think...
Did you feel bad he didn't have any privacy? That was
incredible.
Yeah,
it was. He had a little curtain around. He had a little toilet, and a little curtain. Yeah, he had no privacy, yeah. But I thought that was a very good point. I said, yeah, if you can take it in, why can't you put it out?
It's kids, right?
Yeah.
I mean, he was a kid. He was a little kid.
No mom there to teach him all that stuff early on. Okay.
Yeah.
You mentioned one of the things that you thought kind of drew him towards you was that, you weren't one of these medical technicians, you weren't a doctor, you weren't there to do blood draws or anything like that. I mean, he was surrounded by doctors all the time. It sounds like you were just his friend.
Yeah, I was.
He didn't have a whole lot of that.
Right, exactly.
He didn't have a whole lot of people to come and go.
Yeah, and you bring up a very good point, because the people that worked with him were all women, 90%. There was a couple of male doctors, but Mary was a lady, Jackie Vogel was a lady, the nutritionist was Potts, Elaine Potts was a woman, and then there's several others, PhD women, that were all there. So there was not a lot of male counteracting. And the doctors, they don't sit down and talk about stuff, they do other stuff. So I think I was the male counterpart that he could kind of buddy with.